Ethics in medicine came into view this week because of a physician named Dr. Burzynski who runs a clinic in Houston touting a therapy that he developed and devised, but which has not been subject to phase 3 trials, that is, comparing his treatments head to head against normal conventional cancer chemotherapy treatments. Ethically, physicians have 4 pillars upon which we rely. Those pillars are autonomy, non-maleficence, beneficence, and justice. And in that light, looking at the Burzynski, not trying to make a comment about whether his therapies are good, bad, or indifferent, because I can't, because they haven't been compared, it's a good time to sort of review those medical ethics. Autonomy is our right as a patient to select the therapy we want. It is the physician has the ability to refuse to give us therapy, but the patient ultimately has the autonomy to choose the therapy. We can't force them to have any therapy we think is good for them. It's the patient's choice. Dr. Burzynski isn't violating patients' autonomy. In fact, he's somewhat encouraging it. Non-maleficence is a tricky one. Non-maleficence means that we can't do harm. Part of the old Hippocratic Oath, which most of us no longer follow because of little funny parts of the Hippocratic Oath, but we can do no harm. Now, there is an exception to that. If we know the certain risks of a procedure, know the harm that can be done from a procedure, that's not causing harm to a patient. Let me give you an example. In surgery, we know harm can be done to patients. We know every time we make an incision it can get infected. Every time we go in a body cavity it can bleed profusely. We know that patients can die in surgery, and indeed if you've been in surgery long enough, you probably have had patients die. In terms of cancer chemotherapy, it's the same. We know that patients get sick and patients can die from the therapy that's used to get rid of the cancer. I know this personally all too well. My brother Jimmy died about 5 years ago after receiving cancer chemotherapy for lung cancer. We knew that the lung cancer was far gone in him. We knew that he was not expected to survive, but the idea of the chemotherapy was to debulk that tumor and make his life a little better because he was miserable. Unfortunately, my brother went into severe septic shock and died. Some said to me, the physician did the wrong thing by giving him chemotherapy because they knew there wasn't a chance that that therapy would work. My response to that was we didn't want the therapy to work in terms of cure. We wanted the therapy to work in terms of helping him have a little better life in the time he had left. And sadly, it didn't work out that way, and we accepted that. In this case, I believe Dr. Burzynski truly believes his therapy works. And therefore, he's not doing harm to his patients by offering them that. The other is beneficence. Beneficence is we have the obligation as physicians to do good, to relieve pain and suffering for our patients. And guess what? We don't get to judge that. It is not our determination if we do good for patients. That's up to our patients. And so, as much as we might be upset and say he's not being beneficent, it really is up to Dr. Burzynski's patients, and not us, to determine if we are doing good for him. The last pillar is justice. And that kind of comes down to we have limited resources in the world, and in those limited resources we have to apply them to our patients equally. And sometimes that means we have to speak out for patients on their behalf as a whole and individually. This is where I think Dr. Burzynski fails. If he truly has a treatment for cancer that is better than all of the other treatments that are out there, then it is his duty as a physician, as one of our 4 pillars of ethics, that that therapy be tested against others and proven to a very skeptical physician community, of which I'm one. I'm rather skeptical of his claims. I don't believe them. I would believe them, however, if they were tried against a conventional arm of therapy, and in that double-blind randomized studies, it was found to be better. Currently, the only person that's doing those tests are Dr. Burzynski himself, and nobody in the medical community will believe his results that he publishes on his own. So he fails in one of the 4 parts of medical ethics. Ultimately, Dr. Burzynski's claims about what he can do, or the concern that other people have about what he does, is not something that I as a physician am concerned about. What I am as a physician is concerned about is the justice part of it. Dr. Burzynski owes it to the world. If he truly does have a cancer chemotherapy that is better, or can augment the other chemotherapies and make them better, it is owed to the world as a physician to allow that to be tested by others to prove to it. If not, then Dr. Burzynski is committing a greater crime than what my fellow skeptics are accusing him of. My fellow skeptics are accusing him of being a charlatan and of not having treatment and of being greedy. But the greatest crime is, if he truly does have something, then he is doing and violating the most basic tenet of physician ethics there is. I'm Dr. Terry Simpson. If you wish to comment on this, please go to my website, yourdoctorsorders.com. Thank you.